Namaskaram. Dr. Raymond Price, the President of the United States chapter of the International Society of Surgery, distinguished delegates, it is well and truly an incredible honor, a great privilege, and a humbling moment to be delivering one of the 11 distinguished keynote lectures at the annual Scientific Congress of the American College of Surgeons, which is the world's largest surgical organization. I would like to begin by invoking the blessings of my parents, because of whom I am able to address this gathering, and I would be a nobody without my parents. I bring greetings from Hyderabad, the capital city of the southern Indian state of Telangana. As they say, everything begins with a story. My real story began in 2002 when my mother was diagnosed with breast cancer. I was training to be a breast surgeon at that time at the world-renowned Cardiff Breast Unit. This was well and truly the turning point in my life. Certain startling statistics dawned upon me. I realized that breast cancer is the commonest cancer affecting women in India. Unlike the West, where most breast cancers present over the age of 50, in India, the vast proportion of breast cancers present under the age of 50. Breast cancer is a closet issue. It's a taboo. And due to lack of awareness and absence of a robust population-based screening program, more than 60% present in the advanced stages. This is a lady, as you can see, who presents with a locally advanced breast cancer. Every 10 minutes, a woman succumbs to breast cancer in India. Breast surgery is not a distinct subspecialty in the country. There are very few dedicated breast specialists, and the concept of breast centers was virtually non-existent until 2007. There is very little awareness about the importance of early detection, and counseling was not a part of the medical curriculum until a few years ago. I took a conscious decision with my family to relocate to India, much as my wife, Dr. Jeannie, and I had excellent opportunities in the United Kingdom. I returned to India with a dream to fulfill 4 goals. The first is to establish a breast cancer foundation to create the awareness about early detection, to introduce the concept of breast center in an endeavor to standardize care, to oversee the implementation of a population-based screening program, particularly aimed at the underprivileged community to ensure early detection, and hopefully in my professional lifetime to ensure that breast surgery develops as a distinct subspecialty in India. I was well aware that ideas are dream a dozen, and it is the execution that actually counts. Over the past 14 years, I have been a living bridge between the United Kingdom and India, striving to ensure and replicate the best of British practices in an endeavor to improve the delivery of breast healthcare in a country that I was born and raised. From time to time, you will see various images, buildings and monuments lit up in pink. This is October, the International Breast Cancer Awareness Month, and this is the historic Charminar, more than 400 years old, a historic monument in Hyderabad that is turned pink just a couple of days ago. So the aims of my presentation are essentially fourfold: to touch upon advocacy, to highlight the breast center concept, to describe the screening program initiative implemented in the southern Indian states of Telangana and Andhra Pradesh, and finally to mention about the Association of Breast Surgeons of India, a dedicated breast surgical society which is paving the path to develop breast surgery as a distinct subspecialty in India. My first dream was to ensure advocacy and early detection. Breast cancer, as I mentioned, is a closet issue, and I knew that there was an urgent need to disrupt this attitude. Usha Lakshmi Breast Cancer Foundation is a not-for-profit breast cancer charity that was established in 2007 when I relocated to India. Usha Lakshmi is my mother, a doctor, a gynecologist, and at 88 years, she currently spearheads the activities of the foundation. The main aims of the foundation are to create awareness, to reach out to the community and support breast cancer survivors, I would say conquerors. One of the first things that we have done is to publish information leaflets about every aspect of breast health explained in simple, easy to understand format in partnership with Breast Cancer Care UK, which is currently merged to become Breast Cancer Now. The aims were to ensure that patients were better informed, better prepared, and feel in control at every stage of their treatment. And these booklets were printed in English and in the regional language Telugu. In 2017, inspired by our Honorable Prime Minister's Digital India Dream, the foundation has brought out information on every aspect of breast health, breast cancer, and indeed benign breast diseases, not just in English, but in 12 languages, in English and 11 commonly spoken Indian languages, and it becomes the world's first initiative, and it has, as I explained, all the information required relating to breast cancer and indeed benign breast disease, which can be freely downloaded on both App Store and Google Play Store. And the name of the app is ABCs of Breast Health. After this was launched by one of India's icons, Mr. Amitabh Bachchan, who is a Bollywood celebrity, and soon after...
May I just offer my services, my voluntary services to this wonderful campaign. If in the future you would require to use my face and my voice towards this campaign, I should be more than ready to help you. Thank you so much.
After he launched this mobile app and tweeted about it, several thousands upon thousands of people all across India have downloaded this app and benefited from this information in 11 regional languages. The foundation launched the Pink Ribbon campaign in 2007, and we had international and national celebrities who have been through breast cancer coming to perform or appear in activities spearheaded by the foundation. This is Marcia Barrett, the lead singer of the legendary Bonnie M, who came to Hyderabad and mesmerized the audience in 2008, where more than 5,000 people attended her performance. And that's when, for the very first time, people started taking notice of the foundation. We then had the then United States Ambassador's spouse, Mrs. Jeannie Mulford, who visited us several times and has become the patron of the foundation. And I cannot forget what she has always been saying. She said, your story is one that I will repeat many times when I speak with breast cancer survivors in India and in America. This is Kamala Yash Chopra, the spouse of the legendary late Bollywood producer, Mr. Yash Chopra, a very eminent personality who is once again the patron of the foundation. I've always believed that you do it with passion or not at all. We started the Pink Ribbon Walk, again an activity in the first weekend of October, which is the International Breast Cancer Awareness Month. We started off in 2007 October. This is a patient of mine who underwent neoadjuvant chemotherapy, and after the surgery, on day one, she came to flag off the Pink Ribbon Walk, which is aimed to salute breast cancer conquerors and create awareness about the importance of early detection. When we started off in 2007, just about 50 people joined this campaign, which has now become an annual benchmark event in Hyderabad's calendar. Several thousand people attend and participate in this walk. This is again a 23-year-old patient of mine. Once again, she comes with her brain bag post-surgery to flag off the walk. What started off in Hyderabad, which is the capital city of the southern Indian state of Telangana, we extended this walk to the neighboring city Warangal and to the neighboring state Andhra Pradesh. This is Vijayawada, where we had more than 10,000 people participating in this Pink Ribbon campaign. We've had people from all walks of life who have volunteered to flag off this walk and to participate in this walk, whether it's film stars, sports stars, and politicians. You name them, every prominent person in Hyderabad has participated in this Pink Ribbon campaign. This is the Buckingham Palace in pink, the White House in pink, and Hyderabad is the only city in Asia Pacific region where several monuments and buildings turn pink. You can see the Charminar, the Legislative Assembly on your right, the Buddha statue in the center of the beautiful Hussain Sagar Lake in Hyderabad, and on the bottom right, the United States Consulate General also illuminated in pink. The Raj Bhavan, where the Honorable Governor resides, this is the only Raj Bhavan in Telangana, is the only Raj Bhavan in the country which is illuminated in pink in the month of October. This is the second consecutive year that the Honorable Governor has given us permission to illuminate the Raj Bhavan in pink. The foundation also published Pink Connection, which is South Asia's first quarterly breast health newsletter, which publishes inspiring stories of breast cancer conquerors. As you can see here, there are several breast cancer conquerors who have featured in this Pink Connection, which aims once again to create awareness through innovative ways. Very recently, 4 days ago, the foundation launched a one-of-its-kind national breast cancer and benign breast disease helpline. This was launched by the Honorable Vice President of India, which has been powered by Step 1 and in partnership with the Association of Health Psychologists and 4 national organizations that represent the medical fraternity, namely the Indian Medical Association, the Association of Surgeons of India, the Association of Breast Surgeons of India, and the Breast Imaging Society of India have extended rock-solid support to this initiative. Why helpline? We are all aware that there is robust evidence to suggest that a dedicated helpline providing emotional support and evidence-based information would ensure patients finish their treatment schedule, experience less stress, cherish improved quality of life, and have better outcomes. And the aims of the helpline is to spread hope and courage in the fight against breast cancer and equally reassure the worried well with benign breast disease. Unlike many other helplines, passionate breast cancer conquerors who have been through the grueling grind of breast cancer treatment, along with a team of committed counselors, will be providing free one-to-one support. And as 9 out of 10 breast health issues are benign, the helpline also aims to reassure the worried well. In addition to providing dietary advice by qualified dietitians, particularly to those undergoing chemotherapy. So the breast cancer advocacy initiatives over the past 14 years have certainly made a huge impact, particularly in urban India. The second dream that I had was to introduce the breast center concept in India. As 9 out of 10 breast health issues are benign, women are naturally not happy visiting a cancer center for routine screening or assessment of breast health issues. They would any day prefer visiting a breast health center which aims to reassure the vast majority of worried well, in addition to, of course, treating those who are diagnosed with breast cancer through a multidisciplinary team approach in a sensitive and caring environment. There is evidence from more than 20 years ago that improved outcomes for breast cancer or indeed benign breast health issues can be achieved if specialists with declared interest and training manage patients in dedicated comprehensive breast centers. And mirrored upon the world's first freestanding purpose-built comprehensive breast center established in Van Nuys by Professor Mel Silverstein, and also mirrored upon my experience of having worked at world-renowned centers of excellence in Cardiff, in Nottingham, and indeed at the Royal Marsden Hospital in London. I conceived, designed and established South Asia's first freestanding purpose-built comprehensive breast health center in Hyderabad. I would be failing in my duty if I do not mention my dear friend Dr. Bhaskar Rao, who is the managing director of the King's Group of Hospitals, who has given me a free hand to establish this breast center, which has paved the path towards improving breast health care in India. This is King's Hospitals, which is a multi-speciality hospital, one of the largest private sector hospitals in India. And the breast center was established as a freestanding center where the entire assessment happens in one place in a welcoming and relaxed environment, which is separate from the main hospital. Both benign breast disease and breast cancer is managed not just under one roof, but in a purpose-built, dedicated center by a multidisciplinary team that is exclusively involved in the management of breast diseases. We aim to reassure the worried well all the time. There should be only 3 outcomes in breast assessment: either there is no problem, either there is a diagnosis of benign lesion, or a diagnosis of cancer, and assessment ends at the diagnosis and not before. So before I relocated to India, I realized the importance of a breast radiologist. And Dr. Srikala Jwala, who is the head of breast imaging at Kim's Ushalakshmi Center for Breast Diseases, was identified. She came to the UK and obtained training in breast radiology well before this breast center was established. So just as a stethoscope is important for a physician or a cardiologist or a breast surgeon, the stethoscope is a good breast radiologist and a good breast pathologist. And it's important that we have this team in place before establishing the breast center. And I did well to identify radiologists and pathologists to ensure that they become an integral part of the treatment care that is provided at the breast center, and not to forget a well-trained mammography radiographer as well. No one can whistle a symphony, and it takes a whole orchestra to play it. And I'm ever grateful to the multidisciplinary team, because we are a team because we work together. We are not a team because we work together. We are a team because we respect, trust, and care for each other. Any sufficiently advanced technology is indistinguishable from magic. The King's Ushalakshmi Center for Breast Diseases takes great pride in introducing the very first digital mammography system in South India. We were in fact the second center in the country after Tata Memorial Hospital. Within a week of them acquiring this, we were able to acquire this digital mammography system, which is a revolutionary advance in picking up early subtle changes of breast cancer, particularly in young women. The advocacy that we have created about the importance of early detection ensure that a number of women presented themselves to the breast center for opportunistic screening, and the numbers increased year on year. This is a 51-year-old lady who presented to us for routine screening. We found a cluster of pleomorphic microcalcifications, highly suspicious of breast cancer. A stereotactic biopsy was done, which was proved to be breast cancer, and this patient underwent oncoplastic breast conserving surgery, which certainly is one of the most interesting and challenging advances in breast surgery. For oncoplastic breast conserving surgery requires the knowledge of 3 different specialties by a single surgeon: knowledge in surgical oncology, knowledge in plastic surgery, and knowledge in breast radiology in one person. Up until 2007, the principles of oncoplastic breast surgery were nascent in the country. Having obtained subspecialty training in oncoplastic breast surgery, it has been my earnest endeavor over the past 14 years to popularize oncoplastic breast surgery. Women over the years became forthcoming in sharing their experience, and with a proactive print and electronic media support, I was able to engage and empower the community about the benefits of having breast conserving surgery, also equally ensuring good aesthetic outcome through the practice of oncoplastic breast surgery. A 65-year-old lady presented to us from the United States. She's an Indian who came to India on a holiday. A small focus of DCIS was in the left breast, diagnosed in the United States with a clip left in situ near the microcalcifications after the core needle biopsy. This is the picture on the left where the guide wire is in place, inserted preoperatively under ultrasound guidance, and on the right is the specimen X-ray after wire-guided wide local excision. And after oncoplastic breast conserving surgery, within 10 days, she flew back to the United States. This is a chapter on oncoplastic breast surgery that was published in one of the most renowned recent advances in surgery in 2009, and this was subsequently reprinted in the Indian Journal of Surgery, which has paved the path to the accepting the principles of practicing the oncoplastic breast surgery in the country. And I'm so happy to report that oncoplastic breast surgery is now discussed and is part and parcel of every scientific session relating to breast surgery in the country. Several important celebrities have visited our breast center. Just to name a few, this is once again Jeannie Mulford, the wife of the United States Ambassador, as you can see him there, Mr. Mulford, who had visited us in 2008, and this is her again. This is the British High Commissioner who paid a visit to the King Sushalakshmi Center for Breast Diseases in 2011, and a couple of years ago, the British High Commissioner to India, Sir Dominic, visited the breast center and interacted with patients. The Smart Cities mission was introduced in 2015 in India to enhance the quality of life for people living in the city. And similarly, the Smart Breast Center concept introduced in Hyderabad is resourceful, creative, perceptive, astute, inventive, integrating and adapting technology and newly emerging evidence-based practices to ensure best possible care that our patients so richly deserve. And the breast center concept proved to be a successful concept, and it emerged as a solution to cater to a large number of women who required high-quality breast evaluation. Indeed, the organization and delivery of breast services happened not by serendipity, but by diligent planning, and this was the major advance in the management of a common, emotionally charged, well-publicized cancer in the country. And since 2008, I'm delighted that this breast center concept has brought about a disruptive change in the way breast health center is understood in the Indian subcontinent. My third dream was to oversee implementation of screening. We are all aware that screening by way of mammography is the best way to pick up early impalpable cancers many years before it becomes palpable, and this is the way we can say that we can cure cancers if we can pick up cancers very, very early. And as I mentioned earlier, the opportunistic breast cancer screening program through the dedicated breast center at KIMS Hospital in Hyderabad was really successful. We, in addition to the center conducting screening program, between October and December 2007, soon after I relocated to India, we hired a mobile van, which was a purpose-built large mobile breast screening unit, and key centers in Hyderabad were identified and women were informed about the precise date and time of the appointment, and the screening mammography was done in addition to creating awareness by giving lectures. This is the radiographer from the Jarvis Breast Screening Center who was supervising our screening program. Mobile breast screening in 2007 was not new to India, but what was unique at that time was that this program was organized with international collaboration with a world-renowned breast screening center in the UK, and the breast imaging was triple reported by radiologists from the UK, radiologists at KIMS, and myself to ensure that we quality assure all our mammograms. So over a 3-month period, we screened 950 women and 4 impalpable cancers were detected over this 3-month period, and we had a steep learning curve. A 56-year-old lady was diagnosed with intracystic papillary cancer, as you can see here, through this screening initiative. A 45-year-old lady with a strong family history of breast cancer, you can see a cluster of pleomorphic calcifications, a tubular carcinoma diagnosed. So the opportunistic breast cancer screening program, undertaken through the mobile screening initiative and also through the awareness that has been created by the foundation, has ensured that an increasing number of women present themselves now for routine screening mammography. And so, in those 3-month period between October and December, we had arrived and the breast center was functional and a lot of awareness has been created, thus ensuring that this effect went on, incrementally every year, year on year, more and more women now present to us for screening. But the fact of the matter is that 70% of India's population reside in rural parts of the country, where screening mammography is not a viable option. What applies in urban India cannot be replicated in rural India. And this is the real question: is mammography viable as a population-based screening tool in rural India? The answer is no, because evidence-based guidelines in high-resource countries cannot be replicated in low and middle-resource countries. Population-based screening program is not viable, particularly in rural India, because of the huge costs, huge variation in mammographic reporting, because we have very few breast radiologists, and the fact remains that 87% of our population are under the age of 50, where screening mammography really works. Screening mammography works only over the age of 50, and the vast proportion of Indian women are under the age of 50. So, in an endeavor to find an Indian solution to an Indian problem, and based on the fact that clinical breast examination is an effective screening tool implemented by a trained healthcare worker, because it is simple, it is inexpensive, it downsizes the tumor size, and it's an excellent opportunity to empower people about the importance of early detection. And therefore, the Usha Lakshmi Breast Cancer Foundation launched a population-based screening program in rural Telangana and Andhra Pradesh between 2012 and 2016 in partnership with the local governments of Telangana and Andhra Pradesh with the aims of creating awareness and implementing a screening program. This was a pilot project in 2012. You can see the Chief Secretary of the government of the then Andhra Pradesh government in 2012, flanked by the District Collector and the Health Secretary. In 2014, when the new state of the Telangana was formed, this is the Honorable Chief Minister, Mr. K. Chandrasekhar Rao, who extended unstinting support to the screening initiative. And similarly, in 2014, the then Honorable Chief Minister, Mr. Chandrababu Naidu, extended support to this initiative. This is a meeting with the Director of the National Health Mission in Telangana, who helped us coordinate the program. Audiovisual aids were created by the foundation and booklets were prepared in the regional languages, and healthcare workers who were employed with the government were trained to create breast awareness and perform clinical breast examination to women between 35 to 65 years. If the screening assessment was normal, they would be returned back in 2 years, and if there was any abnormality, it would be reported to the district health officials who would undertake further tests, a biopsy and free treatment under the free Rajiv Arogyasri scheme, which is implemented in the Telugu states. This is the training session. These are the healthcare workers employed with the governments of Telangana and Andhra Pradesh. We conducted several training the trainer sessions, empowering these healthcare workers to create awareness and implement a screening program. This is another set of healthcare workers who are trained. This is a typical village scenario. In the center of the community hall, the healthcare worker is sitting there, as you can see on the top right, empowering the women in rural India, the villages, and through the television, playing audiovisual aids about the importance of early detection and taking them into confidence before performing the clinical breast examination. So over a 4-year period, over 200,000 underprivileged women spread across 4,000 villages were screened for early signs of breast cancer by way of clinical breast examination performed by over 3,000 healthcare workers. 392 cancers were detected, and all of them have been treated free of cost through the free Arogyasri scheme, which is being implemented by the governments of Telangana and Andhra Pradesh. This screening program in the Telugu states in 2016 made a national impact. I was incorporated into the technical advisory group constituted by the Ministry of Health, Government of India, where a team of experts have resolved to implement clinical breast examination-based screening program all over India, alongside oral cancer and cervical cancer screening program. So I'm really happy that the screening program that was implemented in Telangana and Andhra Pradesh became a benchmark. And there has been a paradigm shift of screening to implementing clinical breast examination-based screening program, particularly in rural India, where 70% of our population reside. My final dream, which I'm going to outline, is the genesis of a dedicated breast surgical society. There has been a paradigm shift in the delivery of breast health care, and the concept of organ-based specialists has now been firmly established world over. Breast surgery is a recognized subspecialty of general surgery abroad with structured training for designated breast surgeons. So therefore, based upon the American Society of Breast Surgeons, which is the world's largest society or organization of breast surgeons, and the Association of Breast Surgery in the UK, alongside like-minded colleagues, the Association of Breast Surgeons of India was established in 2011 precisely 10 years ago, which has rapidly emerged to become the voice for breast surgery in India. I am really delighted that I have played a major role in the genesis of this organization, and it took me 5 years to convince the powers that be in the Association of Surgeons of India to establish this as a section of ASI. Unlike the American Society of Breast Surgeons and the Association of Breast Surgery in the UK, I wanted the Association of Breast Surgeons of India to be part of the larger organization, which is the Association of Surgeons of India, because the vast number of breast surgeries in India is still done by general surgeons, where I thought that if they are part of this organization, the main organization, the Association of Surgeons of India, if ABSI is part of this main organization, more and more surgeons will come and attend programs and activities, take interest in the activities of the Association of Breast Surgeons of India. This is Professor Devendra Patel, who has been my guide and philosopher, who is the founder president of ABSI, who was addressing the very first annual general body meeting of the association in 2011. So this organization represents general surgeons, surgical oncologists, and plastic surgeons treating patients with breast disease. And during my presidential term, between 2015 and 2017 at the Association of Breast Surgeons of India, structured training program was introduced to ensure through the ABSI training module, where surgeons in the remotest part of the country would be empowered about the ABCs of breast health, and also to ensure that they are trained in delivering minimum effective uniform standard of care. And this program during my presidential period was rolled out throughout the country, and this is one such program, ABC of breast health, what every postgraduate and practicing surgeon to know. And this kind of a program, which is a one-day program, extending sometimes to 2 days, was implemented all across the country. The other major initiative implemented during my presidential term is to develop a fellowship, a traveling fellowship between India and the UK, where trainees with a declared subspecialty interest in breast surgery were identified through a recognized selection process, and short-term placements were arranged in collaboration and badged by the Association of Breast Surgeons in the United Kingdom at eminent centers of excellence. These trainees came back to India and are practicing in India. One other program which I take great pride is mirrored upon what I've seen at the American Society of Breast Surgeons. And just as a stethoscope is important to a physician, I would like to once again reiterate that doing breast ultrasound bedside and having a good breast radiologist is a stethoscope for a surgeon. So we have trained surgeons to do breast imaging, to interpret mammograms and perform ultrasound-guided biopsies, which I believe is an essential skill for a modern-day breast surgeon. And this is the course in 2016, and this is the course in Hyderabad in 2017, where breast surgeons were trained to perform breast imaging procedures in the centers of excellence. This is the Merrill Institute in Vapi, where there was another training session that was held. This is Professor Laszlo Tabar, the world-renowned breast radiologist, who came upon my invitation, and we held 3 large breast radiology courses in 2010, 2011, and 2012. And these courses were attended not only by surgeons, by radiologists and pathologists, but what is very gratifying is that subsequent to these courses and after the formation of the Association of Breast Surgeons of India, the Breast Imaging Society of India, which represents radiologists practicing breast imaging, was formed in 2012, and this society has really been playing a great role, a pioneering role in training several breast radiologists in the country. This is the Prasad IMAX, which is a film theatre complex in Hyderabad, which has turned pink in the month of October. So in conclusion, Dr. Raymond Price, distinguished delegates, the rising incidence and mortality advanced stage of presentation is certainly a cause for great concern in India. The breast center concept and the advocacy initiatives over the past decade in the country have certainly disrupted breast health care and created that much needed awareness about early detection. Opportunistic screening mammography must be encouraged, and I have highlighted to you as to how in an urban center in Hyderabad at KIMS hospitals, we have encouraged opportunistic screening mammography by acquiring the country's second and South India's first digital mammography system and creating awareness about early detection. But in a country like India, where the vast majority live in the rural areas, clinical breast examination is an effective population-based screening tool. The Association of Breast Surgeons of India certainly is standardizing and paving the path towards developing breast surgery as a distinct subspecialty in the country. Ladies and gentlemen, from when I graduated 30 years ago, I've come a long way. My mother's setback in the form of breast cancer was a driving force. With focus, determination, and hard work, working alongside like-minded colleagues, friends, and the government, I've been able to make a meaningful difference, and returning to my motherland has been a God-sent opportunity. With Lord's grace, clear vision, definite plans, focused action, personal discipline, reliance on the confidence to achieve, and unwavering support has helped me to achieve my dreams. Two roads diverged in a wood, and I certainly took the road which has been less traveled. And one great story can change everything. My heart beats for early detection, and I hope after this presentation, your heart also does. Thanks ever so much for this patient hearing, and ever grateful for this incredible opportunity to deliver this distinguished lecture in the world's largest surgical congress. Namaskaram and Jai Hind.